Welcome to the Health and Wellness Show. Again, my name is Dr. Bradley Bark, and today we're going to be talking about physical therapy at Rock Valley Physical Therapy here in Muscatine, Iowa. We got Craig Bodie here, physical therapist at Rock Valley Physical Therapy, and right now he's just going to give us kind of a little history, a little background on Rock Valley Physical Therapy. So Craig?
Rock Valley was started in 1984 by two physical therapists, and then it changed over the years and brought in an occupational therapist as well. But it's all started in Moline, right near the Rock Island border. That's where it was for years. As it has grown in the Quad Cities, there's now multiple clinics around the Quad Cities and even now outside of the Quad Cities as we are here. I've been with the company since 1997 and worked in two different clinics there, one on the Illinois side and one in Davenport for about 5 years each. And then in 2007, October of 2007, 4 years ago, we came and started this clinic here.
What are some of the most common injuries you see on a day-to-day basis?
It's a good question and a hard question, believe it or not, because it varies quite a bit. We really see everything from head to toe. You know, maybe a neck, maybe a low back, hips, knees, shoulders, you name it. But you know, I would say our most common body areas probably fall in the shoulder and the back area. But that can change a lot. Sometimes it's we get a string of knees, and we certainly see a lot of total joints. That's a very common thing. And then it's you know, anything from somebody who's playing sports to somebody who's hurt at work to you name it, and we cover all of those things. What
kind of treatments do you offer here at Rock Valley Physical Therapy?
The thing that we do mostly, I guess two things that we do mostly. You know, we use our hands, similar to you.
Yep.
And we do a lot of education and try to identify where it is that's the cause of the problem, and that may not be necessarily where the symptoms are, but try to identify that and get to the bottom of it. So just a lot of you know, every person's kind of a individual puzzle, and you just try to identify what it is that where you can intervene and help.
So you'd say education's a really important thing here.
Absolutely. I mean, without that, I think that there's times when people come in and, you know, they're hurting, and
Sure.
and I think maybe you know, they want that feel good stuff, which we certainly get to, but I believe that if you simply do that and send them out the door without some knowledge, they're going to be no better when they come back the next time. And you know, in an hour, they're going to forget they had that modality. And whereas if they understand why they're hurting or what they can do to avoid it, you know, they'll come in the next time and hopefully be better.
Okay. Another thing that I understand too, talking to some people in the community, is, you know, I hear that there's a lot of one-on-one time spent with the patients that come on in, and there's a lot of you, being the physical therapist, actually spending the time with them.
Yeah.
Is that true?
It is true. I think, you know, I can just say the way that we do it here and the way that we've done it in Rock Valley and the way that I've known how to do it, and that is really, really patient-centered. And by that I mean, they come in the door, you know, we bring them back, and we start in, and I want to ask them a lot of questions. I want to know if it's the first time. I certainly ask them lots of things, like I'm sure you do, a thorough intake. But
yes.
But then it's a matter of educating them, showing them things, doing what we can to make them feel better. When someone comes in here, the last thing I want them to do is spend even a minute on the table going through some exercises that is something that they can do at home, or something they've been instructed to do at home.
Right.
When they're here, I want to make sure that they're doing something that on a piece of equipment either they don't have at home, or with the guidance and hands-on and instruction that I'm not available for when they're at home, and try to make the most of it. And so when they're here, it's focused time.
And now we got Gretchen Spies, another physical therapist at Rock Valley Physical Therapy. Gretchen, can you tell me a little bit about yourself?
Sure. I was born and raised in Muscatine. I left to go to college. I went to the University of Northern Iowa for my undergraduate degree, and then I went to St. Ambrose University in Davenport for PT school. And I went there when they had the doctorate program, so I have a doctorate of physical therapy.
All right.
And then right after school, I moved to Alaska, and I was a physical therapist there for a year. And then I started here at the end of December in 2010, so I've been here just under a year.
How often do you see your patients on a regular basis?
You know, that really varies depending on the person. You know, we tend to see people probably more often if they've just had a major surgery, something like a total joint or an ACL repair, a shoulder surgery, something along those lines. But the good thing is that we're very flexible. You know, even if we have you know, somebody comes in and initially it's supposed to be 3 times a week, but for various reasons, whether it's insurance co-pays or scheduling or something like that, people can catch on pretty quickly with their exercises, and so we can adapt that and meet their needs and make it more feasible for them to get in here.
So in order to come here and be a patient, do you need a referral from a doctor?
For the most part, the answer to that is no. Iowa allows people to come to physical therapy without a doctor's referral. Some insurance companies have some stipulations with that, so it might be something where you'd want to check with your insurance company first, or again, just give us a call and we can answer that question for you.
Okay, and another one is, what do you really like about working here at Rock Valley Physical Therapy?
I like that every day I come to work, it's something different. I get to meet new people, I get to treat people with different diagnoses, and it's just a great environment. It's small, it's close-knit, and we have a lot of fun here.
It occurs to me that one of the things that I'm often, or Gretchen, we're often having to instruct people on is how not to hurt themselves with daily things, whether that be squatting or sitting or even coming in and out of bed, etc. So I thought I would use this as a good example. Whether it's a neck, whether it's a shoulder, whether it's a back, so much of that depends on posture. And what I talk a lot about, or we talk a lot about, is neutral. And if every joint in our body likes neutral, if it's wrist, for example, if it stays straight, chances are my wrist is going to be okay. But as we deviate from that, we get in trouble. So as Gretchen's sitting here perfectly, must be on camera, that she would have no problem. She could probably sit there a long time and not end up with much neck or back problem. But this is not the typical case. More often than not, people round out in the low back and they slump. And when that happens, the shoulders come forward, the head comes forward, and they do their daily thing, whether that's typing or sitting at a desk or whatever it might be. And so the simplest way to give a bit of advice for anybody, no matter what their area of problem is simply find neutral. And when the low back just has that little bit of an in curve, and the thoracic spine has a little bit outward curve, and then that brings the head in a good position. So it doesn't have to be artificial, it doesn't have to be plastic straight, but certainly too much of the time we're really soft and forward. You know, I point to the chart a lot because that is anatomic neutral, so that person's very straight. Again, that's not really realistic, but certainly periodically, if you're doing something for hours at a time, if every 20 minutes you can be conscious of simply changing your position, going back to what you're doing, but with more attention to where you're at. Yeah, that's an ideal example. But and then the other thing is when people get out of a chair or something like that. Gretchen, I know, is strong enough to be able to just come forward and stand up and not leave that neutral back position. But so often, if someone's got a problem with their legs or hips or whatever, or just not used to it, that's not how they do it. They tend to deviate a lot. So if you give a bad example, how somebody with more difficulty getting in and out without much attention may really slump, and exactly when they come forward like that and then come up, you know, somebody who might have a back problem already and just not as strong as they could be or should be, daily they end up hurting themselves simply because they're doing it recurrently. And so those are the kind of things. I mean, it's just a small example of how we would qualitatively try to break things down and give people individual information that they can use.
Craig, I want to thank you so much, and also Gretchen, for being on the Health and Wellness Show. Is there anything you'd like to add before we conclude?
Well, first of all, thank you for coming out. It's been fun having you guys. But what I really want, I guess, people to know, when you had mentioned earlier about do you need doctor's referral and things like that, certainly that's fine. But more and more physical therapy as a profession is trying to make people aware that the physical therapist is a part of the team that in some cases can intervene right away. For the people that we have we call it send a friend. What we welcome is having them stop in, and it's a brief conversation, and just get an idea of whether that's easily fixed with just some awareness and stretching, or whether that needs maybe go to your doctor or go to a chiropractor, or work as a team. But at least give somebody an avenue to get some information.
All right. Well, thank you so much for being on the Health and Wellness Show. And remember, health starts with the person in the mirror. Thank you so much.